Dr. Batra is here trying to help us get to the bottom of Aidan's medical mystery. After dismissing it as a potential parasitic infection, we're turning our focus to explore the rare and controversial Morgellons disease. So it's time for my good friend and colleague, board-certified psychiatrist for Dr. Ish Major. He is here and he's going to shed some light on the psychological component and the controversy that exists with this disease and the diagnosis. Always a pleasure, Ish.
Hey, Dr. O, how you doing? Good to see you, Dr. B.
All right.
Good to
we
see
need
you.
you on board here, Doc. So Dr. Ish, help us understand why this is so controversial.
Yeah, it's the one thing that we hate the most as doctors, right? It's confusion. We like a hard, fast.
Yes, we will.
Right?
That's easy. That's
Right?
a
Absolutely.
diagnosis done.
Yeah, and this is one of those things that confuses us as clinicians, and it confuses our patients like Aidan, and it's frustrating all the way around. And with what's going on with Aidan, we don't see it enough to be able to diagnose it consistently. In my 20 years, I may have seen 3 cases like this. And so that's not a big frame of reference. Now, the other thing that's happening here, and we all know as clinicians, once you inject the emotional aspect of a disease process, then it really further muddies the waters, and it gets really hard for us to tell which came first, the chicken or the egg. And that's where we are here.
And Dr. Ish, when you're talking about a disease, Morgellons, that really is a meeting of the physical and the mental, you can't separate the two. You have to proceed in a different way, correct?
You do. I like to say you've got to eat the hot dog from both ends, right? Because the goal is to get Aidan better, right? And I really don't care which came first, right? I want to deal with what he's got going on today that we can help make better in the next few hours or the next few days. And so that's what you've got to do. And whichever makes him better fastest, whether we get a hold of the physical aspect and get that cleared up so he can take some deep breaths emotionally, or whether we get the emotional level tuned up so that calms down some of those physical symptoms, then I'm good with that either way. But Aidan is very unique in that some of his history makes him a setup for this very exact thing that we're talking about here.